welcome to the Zoom conversation on mental health as we are acknowledging the CMHA's Mental Health Awareness Week. And I have a distinguished guest with me, which we'll be introducing shortly. Thank you very much for joining us. It's good to see you again.
Same here.
You left a great impression when we talked a couple of weeks ago, and I had the opportunity to bring it up at our parliamentary mental health caucus as well. We are working on trying to find a time slot that we can invite you definitely to come in and talk about the great work that you're doing. But I figure out that this week, as you know, it's being a CMHA Mental Health Awareness Week. I figure out what better person to call in and have a quick chat on mental health, and especially the great work that you're doing. I don't want to let the cat out of the bag, but I'll let you actually introduce yourself and give us an idea of what is it that you're working and why what you're working is different than the same work that was done by other organizations. So, and what's unique about it, what's a different approach. But I think the important piece of it is that, the initiative that you're taking. So the floor is yours. And welcome to our, I don't know whether it's a podcast, whether it's a Zoom meeting that they're going to record, but welcome.
Well, thank you. Obviously, I appreciate the opportunity to sit down and have a chat with you, Majid. Very honored. Maybe I can just give you a little background as to who I am and my perspective that I'm bringing to this issue before I answer directly the question that you just asked. So currently, I'm Director of Policy and Public Affairs at the Canadian Psychological Association, which is the national voice of psychology. I'm also the chair of the Public Affairs Committee for the Canadian Alliance on Mental Illness and Mental Health. The Alliance is comprised of 13 national mental health organizations that are a mixture of those of lived and living experience and mental health care providers. I've been in total in the health sector for over 33 years, and I'm a trained health economist. And I've had the benefit of working in different corners of the healthcare system that have allowed me to have, I guess, a more well-rounded perspective on certain issues. So I've worked on behalf of physicians. I've worked for the research hospitals and teaching hospitals of this country. I've worked in the federal government for Health Canada for a period of time. And for the last 9 years, I've spent working with the mental health and substance use communities. And I've worked with the Canadian Psychiatric Association. I've worked for the Canadian Centre on Substance Use and Addiction, and now more recently with the Canadian Psychological Association. So the perspective I bring, knowing that our healthcare system is crucial, it is highly valued by Canadians when it comes to dealing with our physical health. So when you think of having a broken arm, or you have cardiac issues, or a hip replacement, or cataract surgery, the system is largely there and deals with the physical conditions that we all need to have addressed. But for the most part, the system has neglected the way that we invest, treat, and provide care for those that are living with mental illness and or substance use disorders. So that is a key issue that I'd like to see changed. And in a very real sense, I'd like to see a better balance between mind and body, mental health and physical health. And this becomes an issue even more so these days in the context of COVID, knowing that when you look at these public surveys that are released very regularly, the mental health of Canadians collectively is in decline. And on top of that, we even knew before COVID, issues of timely access were far and few between when it came to accessing a mental health care provider or gaining access to a treatment bed or supports when it came to a substance use disorder. So it's in that context that I think it's really important to think about what are the roles of government to help expand the breadth of coverage for mental health and substance use health programs and services in this country. And this is where the concept of mental health parity lives and really comes to life.
Thank you. That, I mean, you use the you helped me build a bridge. I mean, when we talked about a couple of weeks ago, you shared with me and you highlighted some of the work that you're doing on the research regarding the mental health parity. So, I know you set the ground for it, but can you kind of demystify what do you mean by mental health parity? Give us a very simple example for those who are watching us. What do you mean by it, and what has gone into it, and when is the report is going to come, and whether I know you're not going to talk about the detail of the report because it's about to be published, but give us as much as you can.
So an example would be if there was someone who was distressed and looking to access some form of psychotherapy and was having difficulty getting to their family physician, or that their family physician didn't have the full professional set of skills to deal with psychotherapy, where does someone go to? Right now in our system, they would have limited options in terms of being covered by Medicare as we know it. So in a world where you can't have access to either a family physician or even a psychiatrist if you have severe mental illness or moderate mental illness that needs to be addressed, or you can't access any services that are in your community, you're either paying out of pocket, you're either waiting for a spot to open up to access the public system, or perhaps you have coverage through your employer's extended health benefit plan. So what we would like to see, knowing that there is a very narrow range of mental health care services that are currently covered by our provincial territorial healthcare systems, we want to see that expanded so that Canadians who need care can get the care when they need it. The other question, or the other issue that you raised is, yes, through the Canadian Alliance on Mental Illness and Mental Health, in the very near future, we will be releasing a discussion paper on mental health parity. And coming to your original question, it builds on the work. And it is a deeper dive with regard to the mechanisms through which the federal government might consider introducing legislation in this area. And the legislation that we call it is the Mental Health and Substance Use Health for All Parity Act. So this paper gets involved to some of the nuts and bolts with regard to what some of the guiding principles of the legislation could look like, what some of the required caveats are needed to ensure fair accountability, overall system performance, adequate federal funding to work in partnership with the provincial governments in moving forward. So there are a number of different dimensions that are in the discussion paper that take it, I think, a few steps beyond, for example, where the Canadian Association of Social Work has taken it, and with the Canadian Mental Health Association. Both are excellent documents. This is just trying to get into a deeper discussion around some of the mechanisms and roles and responsibilities that both the federal and provincial and territorial governments could assume if such an act were to be passed.
Great. So that act, from at least it becomes clear for me that, hey, look, when this point of view or paper is published, that we will be able to get some input into what type of legislation to be introduced. But those who are dealing on the ground with mental health and mental illnesses, how would they benefit from this once it's implemented? Or naturally, this goes through a partnership between between various departments and organizations for it to be able to either become a legislation, and standards developed, and funds go. How does that help the people on the ground? What they would see, what would they see different?
So hopefully they would see an expanded array of publicly funded mental health and substance use programs and services that they could access without delay. So wait times would also come down. A key piece in all of this, of course, is, as you just mentioned, the discussions between the federal government and the provincial and territorial governments with regard to roles and responsibility and appropriate and sustained federal funding that would go to the provinces to assist them in actually expanding the services that they would be providing on the ground. As you know, the provinces and territories, they're stewards of their own respective healthcare systems. and they would be responsible, and they would have flexibility in the context of additional federal funding if it were to come, in terms of designing their respective systems. So when you look at what's going on provincially right now, and I'll just name 3 provinces that are being innovative in the context of trying to expand the array of services in the mental health and substance use space, is Quebec, Ontario, and British Columbia. So there is work ongoing, and there are other provinces as well. I don't mean just to single out those 3 and ignore the others. There is a progressive work that is being undertaken by the provinces. More is needed, and this is where we think the federal government, in terms of its responsibilities, knowing that mental health and substance use health is a national issue, can work in partnership with the provinces. And part of that piece, of course, is having a level of appropriate and sustainable funding. And if you like, you can actually think of it building on the 2017 series of bilateral accords that were signed between the federal government and the provinces that flowed $5 billion over the next 10 years, $500 million a year to the provinces and territories, that was focused on specific initiatives in mental health and substance use.
Yeah, thank you. There's a couple of other aspects that I would like to explore and get your feedback on. As you know, when we talk about the mental health and mental wellness or mental illness, I mean, there are three aspects. We also always talk about some of the social deterrent, socio and economic deterrent into the mental wellness and mental. Is the paper that you're writing is addressing some of that? And I had an opportunity to look at the budget, and I was something stuck in my mind, that all the different budget elements that it's helping with the socioeconomic deterrent for mental health. So I would like to see what your thoughts are. Is that paper covering some of that as well?
In short, the answer is yes. And the way that the paper is designed, there's kind of 5 specific areas that we would see the Act fulfilling, Majid, and I'll just go through them really quickly. So the first one would be recognizing in principle that mental health and substance use programs and services are valued equally to physical health. And that's straightforward. And that really just reinforces the notion of mental health parity. We'd be looking at expanded coverage for evidence-based mental health and substance use programs and services. And this is the third point, playing to your question, recognizing the important role of health prevention, promotion, and education, and the broader social determinants of health. So you can think of some of those social determinants of health, which you refer to the budget. You think about affordable housing, addressing homelessness, income support programs, and of course, childcare. The fourth point is having meaningful system performance indicators so that you can effectively measure and manage the system. And then the last piece is where I think a lot of the discussion, the rub really occurs, is what is the funding roles and responsibility of the federal government providing appropriate and sustainable funding to the provinces, and the quid pro quo that the provinces and territories are meeting the explicit deliverables that are in the Act. So there, in a sense, there's a mutual accountability that we're trying to build into this as well.
I really love the second pillars and I think the fifth pillar that talks about evidence-based and talks about measures and reporting and accountability and transparency on the research side. As you know, the government has made a lot of investment, at least in 2021, on research. What type of evidence-based data are you looking, or are you suggesting we look at, and which jurisdiction do you suggest we benchmark ourselves against to be able to move forward on this?
So when it comes to expanding, for example, the array of mental health services and supports, an example is psychotherapy, where the evidence is already there. There is a significant amount of peer-reviewed literature that talks about the benefits that accrue to Canadians with different forms of psychotherapy. There's also the economic case in terms of the cost benefit analysis that accrues as well. So that's just one piece or one example where the evidence is known. So a jurisdiction that has looked at that and implemented a national system is the United Kingdom. So you look at the IAPT program, the improving access to psychological therapies has proven to be very beneficial, in the sense of having a standardized program that has been administered from coast to coast in the United Kingdom. Now, keep in mind, the UK is one system for the most part. It is a national system, the NHS as it's known.
I'm glad you highlighted that. Thank you.
in Canada, as you know, we have 14 jurisdictions, so it's a different kind of ball game in the sense
Yeah.
that you have each jurisdiction taking responsibility for how they wish to design their respective systems.
Yeah. Yeah. If you have an advice for our those decision makers at the federal level and at the provincial level, what would that be
I
as
think
it
there's
relates to
actually,
the parity?
I think there's clearly the public is telling us this is an important issue. All governments, quite frankly, have made significant investments in mental health, but there is more to be done. And what needs to be done, in my view, is we need to find better ways to improve access on the ground. And so, where the federal government has made a number of different investments recently, and you just think of the budget last week, and they're all important, but one of the key pieces that needs to be enhanced is making sure that there's adequate resources that get, whether it's through the provinces or quite frankly for the direct programs that the federal government is responsible for. And you think of Indigenous peoples, you think of military and the veterans, it's the same issue. We need to make sure that we have resources on the ground to expand care. So that really means also making sure that we design the system that expands in the context of accessing mental health and substance use services. But the other piece that goes with that is making sure that we have a proper supply of mental health care providers in this country. And that's right now, I would say that's a bit of a challenge. So we need to rethink in a more team-based way as to how we provide mental health care. And largely, when you look at the reforms that are, or the innovations that are being implemented by the premiers across the country, they're looking at the context within primary healthcare. So that's a key catalytic piece within the system with regard to how we can improve more efficiently, use a broader array of mental health care providers working within, for example, family health teams.
You talked about access, and given COVID-19, we are being all creative in about how we can provide services or how we can get access to the services, especially with us moving into a digital and online world. How do you think that if we combine the theory of access or easier access, digital, and online, and various portals or various application that's coming in, what are your thoughts on that in a way for us to at least be able to address some of the shortage of access that we have?
So that's a terrific question. And I guess the short answer is it makes a lot of sense to do that, to take advantage and fully leverage technologies. And you look at, for example, the portal that's been introduced very quickly and effectively by the federal government, the Wellness Together Canada portal. So where we can have appropriate information that has been vetted to make sure that we're giving Canadians effective information to follow, having online access, having virtual access to providers is part of our future. And I think the COVID-19 pandemic has really accelerated the adoption of technologies in terms of, for example, today, how we're talking,
Yeah.
but also for how care providers are providing care to Canadians for all sorts of issues. So the online piece, I think, is really important because it can help those Canadians that may be dealing with issues and are resilient in a sense to help them manage their own care, whether it's mental health care or physical care. But it can be a portal or a throughput also to those that need more significant care. So think of those that are moderate to severe, facing some mental health issues or substance use issues that require more hands-on care. So it can be a throughput to that as well in terms of then accessing whether it's a psychologist or a family physician or a psychiatrist. So I don't think it's an either or, I think it's an and in terms of moving forward.
Awesome. In my writing of Richmond Hill, there are a lot of community-based providers, such as Home on the Hill, who's helping people with their mental health issue. Craftsman Center, 360 Kids. Those are the organization that they are kind of grassroots, and they kind of grow from the need of an individual to be able to take care of their children or their loved ones, and then it kind of morphed, and it became an institute. There's very little funding available for them, It's funny that when you're talking about, parity, and you're talking about the role that the federal government can take, you said there are areas that they're within their jurisdiction. You talked about, veterans, you talked about indigenous, and as you know, in 2021 budget, there's funding in there. But what are your thoughts on getting funding from federal government directly to these community-based organizations?
There might be some jurisdictional challenges in doing that, notwithstanding, I hear what you're saying and that they do need resources. But as you may know, in addition to the Canada Health Transfer, which is a major transfer mechanism that provides federal funding to the provinces and territories, and for this year it's roughly $42 to $46 billion, there's also the Canada Social Transfer. So that might be a mechanism to think through, again, funneling, earmarking specific resources in particular areas that are in need, where the provinces see need. The other alternative would be to think about the precedent that was created with the 2017 bilateral agreements that the federal government signed in terms of not only home and community care, but mental health and addiction services. Those agreements, in my mind, were unprecedented in terms of their level of detail and, in a sense, deliverables and accountabilities. So you might want to think about, can the federal government look to engage the provincial and territorial governments in the same sort of due diligence and due process in terms of signing agreements in a bilateral sense that have the kind of specificity that you're looking for?
Yeah, it's great because actually, thank you for highlighting that, because I have 5 community councils, and one of them is on health. So, and the issue of mental health is in the forefront of those constituents. And one of the things that they always brought up was the fact that it's good that the federal government is sending money to the province, but that they don't feel that that's being trickled down to them or being transferred to them. And they were asking whether there is any reporting mechanism, or is there any oversight or transparency or accountability. And I really don't know how to answer that question. And I'm glad you brought up those, at least those precedents, that we could use those models to be able to bring some sort of accountability, visibility to it, and they're kind of make sure that the earmarked money gets into those organization. Any comment on that?
Yeah, I think accountability is crucial, and it goes hand in glove, not only in terms of funding, but just looking for value for money in the context of the healthcare system. We're all looking for maximum benefit and efficiency and impact in terms of health outcomes. So I think it is important. I guess the question is, there's always that, I think it's fair to say, that federal provincial tension with regard to who is reporting to whom. And perhaps one way to reframe it is that where governments are receiving funding in particular areas, is that they're reporting out on an annual basis to the respective populations. So it isn't necessarily a relationship where it's a dominant submissive relationship between the federal and provincial governments. They're partners already. They have different roles to fulfill, but still at the end of the day, there's only one taxpayer. Yeah. And I think it's the notion of accountability and showing taxpayers, who are the investors in Medicare, in our social programs, the kinds of outcomes that governments are achieving.
Yeah, well, that's great. You mentioned the amount of money that's being transferred to the provinces and to the 14 different jurisdictions, to the tune of $43 to $45 billion a year. Now, other jurisdiction, and you highlighted UK. Do you have any idea around how much of their, I don't know, other GDP, or how much of the money that's been earmarked for healthcare has been, what percentage of it is allocated to mental health, and what type of services, and where are we in Canada, and how much are we ahead, are we behind, where are we on that?
I don't have the numbers at my fingertips. Historically, Canada has invested or devoted a larger share of its GDP to healthcare compared to the UK. I think one of the questions, though, to ask, just in the context of our conversation around mental health and substance use, is what proportion of health spending is being devoted to mental health and substance use. So in the UK, it's around 12 to 13% that they're devoting. Based on our most recent numbers in Canada, we're at the 7.5% rate. So, and again, money isn't everything if it's not spent well. So we want to make sure that we're obviously doing the right things and having an impact in terms of access and better outcomes. But it's important to consider just in the context of the kinds of resources that we need to improve access, and also just to improve the overall system design that includes access to mental health and substance use health programs.
Yeah, so we got about 5.5 points difference. But let me ask you another question. Do you have any insight into whether that 13% is spent in this categories of support for mental health? And then in Canada, it's also comparable. Is it spent on the same categories but less amount of money, or is it that it's the money is focused on different priorities?
That's a great question, Majid. I can't give you a confident answer. I certainly can find out for you, but I just can't give you any clarity with regard to the allocation of the money.
Yep, that's fine. That's no worries. I mean, this highlights the fact that we really need those numbers, and this highlights the fact that we really need to be evidence-based, and we need to be able to invest in research and make sure that we get the money that's needed to be able to have an answer to these questions. You know, what are the right priorities? How much money based on our needs, correct? And how much money should go? And what is the outcome we're looking for? In how much we need to invest to make sure that we achieve those. Glenn, thank you very much. It's been quite informative. I know you're quite busy, especially during this week, and you found the time to come in and chat with us. This was important, and the work that you're doing is really important, and I'm quite passionate about it. And thank you very much. Any closing comments you may have?
I would say three things. There is no health without mental health. As much as we focus on physical health, for me, mental health is at the core of who we are as a human being and allows us to achieve our full potential. I would say also mental health matters. It is important not only today, but tomorrow, and it also positions us in terms of playing an important role with regard to a vibrant society and a prosperous one. Then the last one is thanking you. This is terrific, and I really appreciate the opportunity to dialogue with you. I look forward to many more conversations with you. And in your leadership role as chair of the Mental Health Caucus, I think you do great work in the context of bringing together all members of Parliament to talk about this issue, because in a sense, mental health knows no political boundaries. It is an issue regardless of where we come from or the perspectives that we hold. So thank you for that.
Thank you, Glenn. And these are great thoughts to leave. Excluding the third one, the two that you mentioned, the number 1 and 2, is really important for us to remember during this week. And every week, going forward. We need to make sure that number 1, we deal with the stigma, we feel comfortable talking and, exercising the principles of mental wellness as well. And, in building those resilience and the strategies that we need to be able to deal with it. So I thank you for that. I extend an invite to both my health community council, as well as our all parliamentary mental health caucus as the co-chair. I have the honor and pleasure of co-chairing that caucus with Senator Kutcher, which is a thought leader and a leader in that field as well. I'm sure you know Senator Kutcher, and we look forward having you on both as a panelist in both events as a panelist to further discuss and about mental health and how we could look forward, as well as looking forward to the report and see how we can advocate for it. So I thank you, and have a great evening and stay safe until we can get together in person. But the Zoom has allowed us to come together and advocate for a cause that we are both passionate about.